Welcome to my YouTube channel. Before we start the video, we will discuss about the previous question. So previous question was, a pregnant client with diabetes mellitus asks the nurse about insulin needs during pregnancy. What information should the nurse provide to the client? So the answer is, the nurse should inform the client that the maternal glucose crosses the placenta but the insulin does not. During the first trimester, maternal insulin needs decrease. During the second and third trimesters, increases in the placental hormone causes an insulin-resistant state, requiring an increase in the client's insulin dose. After placental delivery, placental hormone levels abruptly decrease and internal requirements decreased. In addition, the fetus produces its own insulin and pulls glucose from the mother, which predisposes the mother to hypoglycemic reactions. Now we will discuss about some questions regarding labor and birth. So the first question is, the nurse is performing an assessment of a client who is scheduled for cesarean delivery at 39 weeks of gestation. Which assessment finding indicates the need to contact the physician? Options are hemoglobin of 11 gram per deciliter, fetal heart rate of 180 beats per minute, maternal pulse rate of 85 beats per minute, WBC count of 12,000 cubic millimeter. So answer is B. A normal fetal heart rate is 110 to 160 beats per minute. A fetal heart rate of 180 beats per minute could indicate fetal distress and would warrant immediate notification of the physician. First option is wrong because by the full term, normal maternal hemoglobin range is 11 to 13 gram per deciliter because of the hemodilution, so it's normal. Hemodilution means it involves removing some of a patient's own blood and replacing it with fluids to maintain normal volume. Third option is not correct because the maternal pulse rate during pregnancy increases 10 to 15 beats per minute over pre-pregnancy readings to facilitate increased cardiac output, oxygen transport and kidney filtration. So 85 pulse rate is normal during pregnancy. Fourth option was WBC count of 12,000. As we know, the normal range of WBC is 4,000 to 11,000. But in a normal pregnancy, it began to increase in the second trimester and peak in the third trimester. So 12,000 WBC counts are normal here. Question number 2. The nurse is monitoring a client in labor. The nurse suspects umbilical cord compression, which is noted on the external monitor tracing during a contraction. Options are variability, accelerations, early decelerations, variable decelerations. So answer is D, variable deceleration. Variable deceleration occurs if the umbilical cord becomes compressed, reducing blood flow between the placenta and fetus. Remaining options are wrong because variability refers to fluctuation in the baseline fetal heart rate. Accelerations are a reassuring sign and usually occur with the fetal movement. Early decelerations result from a pressure on the fetal head during a contraction. Question number 3. A client in labor is transported to the delivery room and prepared for cesarean delivery. The client is transferred to the delivery room table. The nurse should place the client in which position? Options are spine position with a wedge under the right hip, Trendelenburg's position, prone position with the legs separated and elevated, semi-fowler position with a pillow under the knees. So the correct answer is A, spine position with a wedge under the right hip. Positioning for abdominal surgery necessitates a spine position. However, a wedge placed under the right hip provides displacement of the uterus. Option B is wrong because Trendelenburg's position places pressure from the pregnant uterus on the diaphragm and lungs, decreasing respiratory capacity and oxygenation. A prone and semi-fowler's position is not practical for this type of abdominal surgery. Question number 4. The nurse is admitting a client to the labor room and attaches an external electronic fetal monitor to the client's abdomen. After attachment, what is the next nursing action? Options are identify the types of accelerations, assess the baseline fetal heart rate, determine the intensity of the contractions, Determine the frequency of the contractions. So answer is B. Assessing the baseline fetal heart rate is important so that abnormal variations of the baseline rate can be identified if they occur. Option C is incorrect because the intensity of contractions is assessed by an internal fetal monitor, not an external fetal monitor. Options A and D are important to assess but not as the first priority. The fetal heart rate is evaluated by assessing baseline and periodic changes. Periodic changes occurs in response to the intermittent stress of the uterine contractions and the baseline beat-to-beat variability of the fetal heart rate. Question number 5. The nurse is reviewing true and false labor signs with a multi-parous client. The nurse determines that the client understands the signs of true labor if she makes which statement? Options are: I won't be in labor until my baby drops. My contractions will be felt in my abdominal area. My contractions will not be as painful if I walk around. My contractions will increase in duration and intensity. So correct answer is D. True labor is present when contractions increase in duration and intensity. Option A is wrong because lightening or dropping leads to engagement and occurs when the fetus descends into the pelvis about 2 weeks before delivery. Option B and C are incorrect because contractions felt in the abdominal area and contractions that ease with the walking are signs of false labor. Question number 6. Which assessment following an amniotomy should be conducted first? Options are: cervical dilation, bladder distension, fetal heart rate pattern, maternal blood pressure. So answer is C. Fetal heart rate is assessed immediately after amniotomy to detect any changes that may indicate cord compression or prolapse. Amniotomy is also known as artificial rupture of membranes, is the intentional rupture of the amniotomic sac by an obstetrical provider for diagnostic purpose. Option A is not suitable here because when the membranes are ruptured, minimal vaginal examination would be done because of the risk of infection. Bladder distension or maternal BP would not be the first thing to check after an amniotomy. Question number 7. The nurse has been working with laboring client and notes that she has been pushing effectively for 1 hour. What is the client's primary psychological need at this time? Options are: ambulation, rest between contractions, change positions frequently, consume oral food and fluids. So answer is B. Encouraging rest between contractions conserve maternal energy, facilitating voluntary pushing efforts with the contractions. Remaining options are not correct because ambulation is increased during early labor, changing position frequently is not the primary psychological need, food and fluids are likely to be withheld at this time. So now we will discuss about important points regarding labor and birth. First point is, in true labor, contractions increase in duration, intensity, cervical dilation and effacement are progressive with engagement and descent of the fetus. Second point is, in false labor, contractions are irregular and do not produce dilation, effacement and descent. Third point is, if fetal bradycardia or tachycardia occurs, change the position of the mother, administer oxygen, and assess the mother's vital signs and notify the physician as soon as possible. Fourth point is, interventions for late decelerations include immediately providing placental blood flow and fetal oxygenation. Fifth point is, if variable decelerations occur, discontinue oxytocin if infusing, change the position of the mother, administer oxygen and assess the mother's vital signs. Sixth point is, if the membranes have ruptured, assess the FHR because of the risk of the prolapsed umbilical cord and assess the color of the amniotic fluid because meconium stained fluid can indicate fetal distress. Here is the question for you. A client at 39 weeks of gestation is in active labor. The nurse is monitoring the fetal heart rate and notes that the heart rate is 180 beats per minute, lasting for longer than 10 minutes. What should the nurse do? We will discuss this answer in the next video.